Away from politics, the month of January is marked worldwide as Cervical Cancer Awareness Month. The disease is the second most common cancer, with about 3,000 women diagnosed annually in Ghana. In the Ashanti Region, 20 women died of cervical cancer in 2023. Our correspondent Beatrice Piogabra has filed this report.
42-year-old Obiniwa, as we have decided to call her in this report, was first diagnosed with cervical cancer in 2022. Just like many women, she was in self-doubt and refused to go for second screening, although she saw blood after sexual activity with her husband. Lack of knowledge about cervical cancer did not draw her attention to a possible case.
Before it was confirmed, normally when I'm having an affair with my husband, I noticed blood. But at that time, I thought it was because of the affair. And I thought because I'll be menstruating very soon. That's how come the blood. But later that I was diagnosed, then they confirmed that I actually have the disease. That was when I started paying much attention to it.
Cervical cancer is a growth of cells that starts in the cervix and is a sexually transmitted virus caused by the HPV. Symptoms include bleeding after sex, bleeding after menopause, and offensive watery vaginal discharge. In the Ashanti region, 2,000 women were screened of cervical cancer in 2023. Out of the figure, 200 tested positive between the ages of 25 and 55, with 20 deaths recorded. Ashanti Regional Health Director Dr. Emmanuel Tinkran admits an increase in cases, but said it was due to the intensified awareness of the disease.
The issue is that the moment you start creating awareness, the cases will definitely increase. So if you look at the trend, you have to match it with the campaigns that you are doing. So the moment you intensify campaigns, you are creating awareness, you are providing facility for treatment, then the number of cases will go up because the more people are now reporting with the cases.
Obiniwa confirmed her status after a second screening in 2023 and was hit psychologically. With encouragement from health professionals and her husband, she started treatment.
I was in self-doubt. I didn't believe it because I couldn't believe it could happen to me. So I doubted it. That very first day that it was confirmed, I was so down. I thought everything has come to an end because I was asking myself, where from this? How come? Because everything was normal. The treatment was just a day. That day when I went, it was a machine that they use for the treatment. So it was some few minutes. Let's say about 10-15 minutes, then it is done.
Regional Health Director Emmanuel Tinkran noted cultural inhibitions about the female reproductive system makes awareness creation a challenge, but noted it was high time the inhibitions were done away with to save the lives of women.
We can easily mention breast. And even I'm talking in English, so I can say vagina easily. But if you tell me to convert it into tree, it will be very difficult for me to say that. So the best thing I can say is maybe be wasi na be a wasi. But how many people understand wasi? You have to say it as it is. But the culturally is not acceptable. So sometimes when we are giving this education, even the health workers don't want to even talk about it. So how can maybe an ordinary person? Yes, so that's one of the challenges that we have with the awareness creation and then the education.
The Ghana Health Service is advocating the inclusion of cervical cancer vaccination into its expanded program on immunization as a long-term solution to the increasing cases of cervical cancer. Beatrice Piogabra, TV3 News, Kumasi.